Welcome, and thank you for joining the Coverage to Care Partner webinar. Today, you will hear from Ashley Petticord-Austin, Health Insurance Specialist at the Centers for Medicare and Medicaid Services Office of Minority Health and lead of the Coverage to Care initiative. The goal of today's presentation is to help provide you with tools to serve your community, be it to improve health insurance literacy, better understand how to choose a health plan, or make an appointment with a provider. With open enrollment shortly approaching, it is a particularly important time to make sure consumers understand how to enroll in and use health coverage to get the care they need. Before I turn the presentation over, if you would like to turn on closed captioning or view a live transcript during the webinar, please click the CC icon at the bottom of your screen. I will now pass it over to Ashley to begin.
Hello, everyone, and thank you for joining. So you can see here a list of what we'll cover today. We'll be going with a couple logistics and reminders, and then we'll give you an overview of the Coverage to Care initiative and highlight some of our key resources. Then we will give you some key dates to keep in mind just for open enrollment. And then we'll dive into two of our resources that are particularly helpful for this time of year, listed on the screen, Enrollment Toolkit and the Manage Your Healthcare Costs. And then we'll close out with some information on how to get involved, and whatever time is left, we'll be able to use for question and answer. So a few reminders today. You can submit questions throughout the webinar to the chat box, and we'll try and answer as many as we can as time allows at the end. For any additional questions, you may contact the Coverage to Care team at coverage2care@cms.hhs.gov. Slides and a recording of this event will be available after the presentation on our webpage on our Webinars and Events page. Next slide, please. I'm now going to move into our brief overview of the Coverage to Care initiative. Next slide. So Coverage to Care is one of many initiatives that our office has, but I do like to take a minute to think about our office's mission and vision and share that with you as well, because it does list our focus populations. These are populations that often sometimes have low health literacy or other challenges and barriers to reaching care. So that's what we tend to think about when we're designing the Coverage to Care initiative and individual resources. And what we think of when we're thinking of topics, we try and think of what these populations in particular might need so that we can help increase health literacy among all people. But it is important to keep in mind that despite the office it comes from, the Coverage to Care initiative is applicable to any consumer, and anyone can benefit from it. And it also doesn't matter what type of insurance you have. So whether it's Medicare, Medicaid, private employer insurance, or something through healthcare.gov or something else, you can still benefit from the program. So Coverage to Care was created with the idea that as people are getting health coverage, whether it's the first time or the first time in a long time, or perhaps the first time as a young adult or as an independent adult, a lot of people are going to need a little help in knowing how to use it. So again, regardless of who you are, anyone can use Coverage to Care. What we want is for consumers to be able to use their health coverage and actually understand it enough to make an appointment with a provider who takes their coverage and then receive regular preventative care. And this will help consumers to live long and healthy lives. Next slide. As a reminder, all of our resources are online. Here's a screenshot of our page. You can see that it's on our CMS OMH site. But if you use the navigation on the left, you'll see our C2C page and subpages for consumer and partner resources, and a few other key topics like COVID-19. Next slide. So today we'll be discussing two of our C2C resources in a little bit more depth. Again, that's the Enrollment Toolkit and Manage Your Healthcare Costs. This slide does list some other resources that we have available as well. I do like to take a second to talk about the Roadmap to Better Care. And that one is pictured, the kind of poster version of it is pictured on the screen. But this is a signature resource that most of our resources are developed around. It takes steps to healthcare into 8 steps, and you can customize these to the individual. You can take it one step at a time, or you can go through all 8 steps. It is available in 8 languages, as well as a travel version. So that would be able to walk someone through, why is this important in the first place? How do I understand these terms? Where do I go? How do I find a provider? What do I do? How do I make the appointment? What do I do to get prepared? What do I need to bring to the appointment? Making sure that the provider is right for them and that they feel comfortable, that they can go back and return. And then what to do after the appointment. So maybe it's a prescription, maybe they need to update their healthcare.gov information. whatever their care plan might have. So that's an important resource to focus on. Another one is 5 ways to make the most of your health coverage. It's a little bit of a shorter front to back version of the roadmap. And it highlights what areas that consumers would really want to focus on to address first. If they only have a couple minutes with a consumer, this might be a good resource too. We do have a little bit on COVID-19 and also on telehealth, which shares some important information for consumers to help stay safe and get the care that they need during this public health emergency. And then we have a lot of flyers that talk about preventative services. These tend to be really popular. They highlight the services that are under most plans covered at no cost for $0 copay. So we have some for adults, women, men, infant, teens, children, and you can choose whatever population that you're working with. And then finally, we have a partner toolkit. And that toolkit is available in English and Spanish. So we actually just updated it. So if you haven't looked at it in a while, it'll still look familiar, but all the broken links and things are fixed. And it's a little bit easier to find and open on our website. But that does have prepared language in blog posts or social media posts, content and graphics, and everything is in English and Spanish for you to just take and use. Okay, we'll go ahead to the next slide. And we'll go ahead one more so we can look at some key dates real quick. So I'm sure this will be familiar to a lot of you, but I want to make sure that we announce them here. So before we dive into the resources, here on the screen right now is the Medicare Open Enrollment dates. So we've already started this one. It lasts through December 7th. And this is for coverage that would begin the start of 2022, so January 1, 2022. So please take some time. If you have consumers that are on Medicare, encourage them to take some time to review and compare their health and drug plan choices, make sure that they know what their plan is going to be like next year. If they want to keep their plan, make sure that they still want to keep their plan, or if there's something that might be better for them. And then the next slide has our marketplace event, open enrollment dates. So coming up very soon, November 1st, open enrollment will begin. And this is for coverage that will begin also January 1st, 2022. So you can encourage people to go to healthcare.gov. They can do some window shopping, get the latest news, but that is coming soon, just Monday. So I'm sure everyone is getting ready. And we'll go ahead into the next slide. So we can start talking about the Enrollment Toolkit. So this toolkit is for community partners, assisters, and people who help consumers enroll in coverage or change their plan. It is intended for you to help consumers to choose the plan that meets their needs, or make sure that their coverage is going to help them get the care that they need. So here you'll see where we kind of give an overview of the sections of what's included in the toolkit. And we're going to go through each of these today. So next slide, please. So first, we share why consumers should sign up for health coverage. This is where we can outline some of the benefits, like coverage is security. Coverage allows you to get the care you need to stay healthy for your loved ones, and it's important to get regular care. It helps cover the cost of an illness or an injury, and helps reduce the stress of trying to find or afford health coverage when you really do need it or when you're sick. So we can also flag for consumers that sometimes health coverage might be a lot more affordable than they think. And most consumers are required to maintain some essential coverage, though there are, of course, some exemptions. And we'll provide resources to help find out if they're eligible, and if so, how to get it. So in the next slide, this next section is where we share some information about what consumers would want to know before they're choosing a plan. So we can list the 10 essential health benefits. We also mentioned that plans might cover preventative services and vaccines with no out-of-pocket or $0 copay, is how a lot of people would think about that. So that's a great benefit to have and to stress, is that, yes, you do have to pay for the monthly premium, or maybe you can get some assistance to help with that. But once you do, you're able to get, there are services that will be covered completely. So consumers may not understand common healthcare terms such as premiums, copay, or deductible. So we use this section to talk through those as well. We can offer definitions, but we also offer some examples to help explain. And then, of course, consumers will also need to understand how to budget for healthcare costs in their regular budget. A lot of people don't think that they can afford coverage, or they don't realize that financial assistance may be available. So we provide information about premium tax credits and cost sharing reductions, and then some resources to help find out if they qualify based on their income. And the next slide, please. So our next section is what consumers would want to know before enrolling. So once they think they have a plan in mind, there's some things that you're going to want to make sure people truly understand before finalizing. So this is where we give some discussion starters and diagrams to help explain the benefits of different plans. So for example, some plans may have very low premiums, but they might have limited provider or hospital networks, or maybe they have a high out-of-pocket cost. Other plans might have a higher premium, but a better selection of providers and hospitals and a lower out-of-pocket cost. So that could mean varying differences of deductibles, co-pays, or co-insurance. So we encourage you to ask a consumer to help think through what things are going to be most important to them, and what will they be able to afford best, so that you can help them personalize and choose which one's going to be best. All right, next slide. So this section discusses steps that consumers would take after they've enrolled in coverage. And so of course, we would encourage consumers to confirm that they're covered. So perhaps that's very simple. They got an insurance card in the mail, but if they don't hear from their plan, or they're not sure if they finished the enrollment process, we want to make sure that they look into that. So we share a few ways on how you can do that. And some consumers may not be aware, or if their financial assistance changed, they might not be aware that they do have to pay premiums every month. And that first premium is, of course, very important to make sure that is paid, and be sure that their coverage is maintained. So do tell them that they need to do this each month, even if they don't use services. And you can let them know that once they enroll, they must pay the first premium directly to the insurance company, not to the marketplace. And they would follow any instructions from their insurer about how and when to make that premium payment. So while the consumer was enrolling in coverage, you probably talked about whether they had a provider or not, to make sure that if they did have a provider, that it was included in their plan's directory. If they don't, explain that having a regular provider is an important first step to getting primary care and preventative services. So some consumers may be assigned a provider by their plan, but if they want to change providers, do be sure to show them how to contact their plan and do so. And you may have also talked about how consumers' ongoing treatments or prescription drugs costs would be covered under their plan. So this is a good time to also remind them that they'll need to take action to getting their care while their coverage changes. So if a consumer needs ongoing treatment for a chronic condition or a prescription that they fill regularly, make sure that they talk to their provider immediately to make sure they don't need to do anything under the new plan. And then lastly, the information consumers enter in the marketplace application on healthcare.gov, like family size, household income, make sure that all of that is still up to date, and that they would want to keep that up to date throughout the year in case anything changes, simply because it's used to calculate the premium tax credit. So remind consumers about the importance of keeping that information current so that they get the right amount of assistance and there's no surprises. Okay, now the next slide. The final section of this toolkit includes information for helping consumers with special circumstances. So that would include our American Indian or Alaska Native people, non-English speaking populations, or those that are not born in the United States. So we share some information specific to each of these populations about finding care, enrolling in coverage, and then getting in-language assistance, as well as a little bit more on financial assistance. So if you're looking for some of those resources, please do visit that section. And so that wraps up the enrollment toolkit. You may have seen this, I should have mentioned in the beginning that the enrollment toolkit was just updated this year. So it also has a little bit of information about the American Recovery Plan. So if you're looking for some quick facts on those updates, please do check out the enrollment toolkit for that as well. You can see that it's a little bit shorter and simpler than in the past. So hopefully you find that to be a useful document. We're now going to talk a little bit more about another financial piece, then manage your healthcare costs. We'll go ahead and advance this slide. And one more. Thank you. So many of our partners will receive questions from consumers about all aspects of their health coverage. A lot of you help a person choose a plan or review a deductible and copay. and maybe help someone use their health coverage. But we are not financial advisors. None of us here are, right? So we need a little bit more to help. We also know that a lot of consumers still find that the cost of actually affording to use their health plan is what's keeping them from care. So if someone understands the cost really well up front and knows what they can afford, then and then chooses the right plan, that'll help them actually use their care. So that's what we have this piece to assist us with, and why we wanted to bring it up now during open enrollment. So manage your healthcare costs is trying to meet those needs. It basically walks through financial aspects of health coverage, offers definitions, and helps someone think about what to consider. It's a series of tools, and then you can hand these over to consumers to help them work through these tools, which will then in turn help them choose the best plan that they can afford. So this is based off of the Consumer and Financial Protection Bureau's resource, My Money, My Goals. They actually have a lot of financial assistance planning information through that initiative with the CFPB. So if you're looking for something else that talks more about finances, do check that out. But this one is particular to healthcare. So first we offer definitions and we explain what costs are involved. And then we offer people a place to list those for their individual plans so they can find it. And then we offer tools to track what income is coming in and what's going out and what that means in terms of their health coverage and what they can afford to pay out of pocket for premiums, copays, and deductibles. So actually budgeting for any monthly expenses, including your healthcare. And then finally, we offer information on how to pay a premium. So we'll take a look at some of these now. We'll go ahead into the next slide. So the first one, understanding healthcare costs. So we see this information in a lot of our coverage to care resources to discuss what a consumer pays, what spending limits are, how people can save. But we review all of those here so that it's together with the financial pieces. Next slide, please. So again, providing some of these key terms, these definitions that a lot of you on the phone are probably very familiar with and could offer these definitions in your sleep, but it's really great to have them handy in case someone says, what is a deductible again? And we offer an example about what that is. So we give definitions for premiums, deductibles, copays, coinsurance. These are the most important definitions that we're really going to want to make sure we do review with a consumer. So when it comes to choosing something that you can afford, these are the ones we're going to need to talk about. So we discuss what a premium is and how you pay it each month, of course. And we make sure that they would know that premiums generally are paid monthly, regardless of whether they use the coverage. And then deductible is a very important term because it can be a bit tricky to understand. It varies a lot from plan to plan. Some services are the deductible applies and others it doesn't. And what does that even mean? So we talk through that here. And then finally, we give some examples to help a consumer understand that it's very affordable to still get preventative screenings. And then finally, we discuss copay versus coinsurance. So generally, someone might be familiar with just one of these, or maybe they know that they would have one or the other, but we talk through those and give examples of the difference. So we find it's the best way to kind of define these with a consumer is generally to offer the example that helps familiarize them and make them realize that, oh, okay, I have dealt with this before. I do not understand what that is. So we have some examples that we try and give in the resource as well. So on the next slide. Thank you. So this is where we talk about spending limits. So making sure that a consumer knows what cost will be out of pocket and then talking about the limit. And this graphic maybe would be helpful to understand. It's supposed to be a wallet. So thinking about all of the things that you're paying yourself. So out of pocket would be things that you're paying for. So helping them make sure that they understand that. And those are the pieces that we're wanting to make sure a person is budgeting for, and not just the monthly premium, but these other expenses as well. Next slide. So then we share some ways consumers can save, specifically using the premium tax credit, of course, and cost sharing reductions. We also highlight the essential health benefits that all marketplace plans will cover. And that includes doctor's services, inpatient and outpatient care, prescription drug coverage, pregnancy, childbirth, mental health services, and more. We also list that most health plans will cover a set of preventive services, as we said earlier in the webinar, and that's going to be at $0 to the consumer. But it's important for consumers to remember that in order to get those services at no additional cost, they would, of course, need to see a provider that is in their network. If you need to help someone understand that, you can refer them back to the roadmap. The next slide. This graphic here on the slide is actually taken right out of the resource. Regardless of whether you're looking for a financial resource, if you're just looking for like a handy card, this might be one that you would might like. And you might even want to pull it out or make some copies of it. It's similar to another resource we have, but a little bit shorter. We have one that's called My Health Coverage at a Glance, which gives a little bit more space for people to fill this information in for themselves. But this one is another worksheet that could be helpful just because it's a lot of essential information. So once somebody learns, okay, this is what a copay means, now this is my copay, this is a great chance to write that information in. We can advance to the next slide. So here's where we offer the 3 steps to help consumers walk through their finances and see on paper what they can afford. So first, we got to figure what's coming in, that's your household income, and then what's going out, your spending cost. And then third is to shop for and apply for some financial assistance. So here's one of the consumer tools that can be given to someone who's trying to figure this out for themselves. That's tracking your income. So that would be our first step. For some people, it's going to be pretty easy to complete. They have this information available. Maybe they've done this before. Maybe they have it on a weekly basis. Maybe they have it on a monthly basis. For others, it's going to be a bit more complicated. They may have several different types of income coming in that they need to add. Some of those might be weekly, some might be monthly. So when we allow someone to think about these in the same terms as what they would be paying for their premium might be useful. For some, that might be the first time that they look at it in terms of weekly. Others might be the first time that they look at their monthly income. So that's important for a consumer who's trying to afford a premium. Oops, can we advance one slide, please? Thank you. That was the tracking tool we were just talking about. And then one more. Thank you. So this is where we provide a chart for our next step, tracking our spending. So I'm sure I am definitely guilty as someone who could probably do this more often than I do. And a lot of us could probably use it with some regularity just to, but if we look at all of our costs that we're doing on paper, are we including our healthcare costs in that? So maybe someone has a monthly budget or knows roughly what they're spending and where it's going, but are they including their healthcare costs in that? Did you put your premiums in? I know I have 2 young kids, so I know that I'm going to have sick visits throughout the year. And those you do have to pay for. So when I take them for their annual health visits, yes, those are $0. But when I take them for a sick visit, for colds or what have you, or if you need to go in for a visit with all of the COVID scares and everything, you might be going a little extra. So making sure that we're affording any sick visit costs as well. If you have prescription costs each month, you might know what those are already or have an idea of what those might be. So making sure to include those as part of your regular spending costs. So some of that you might be guessing, but just like other things, it's important to remember to write down those out-of-pocket costs. And here we have shop for plans and financial assistance. So it's time to go back and look at the consumer's current plan. Is this the right plan? And then once open enrollment begins on Monday, to begin to shop for plans. So we always encourage people to apply for financial assistance. Even if they think that they're not going to get it, it's best to apply. And then there's, if you're looking for a little bit more, or someone asked you for some more help with financial assistance and you need somewhere to send them, I've included the CFPB link here for Your Money, Your Goals. So if you're looking for a little bit more, I would check that out. And then the last section of Manage Your Healthcare Costs is about paying the premium. So many consumers will choose to do this online, but there are other options. And sometimes those are a little harder to find out. So we listed those in this resource. And we even talked about prepaid cards and a few other options as well. Okay, so we have a lot of community partners here today from lots of different areas of the community and different types of work. But we want to talk about how you can get involved and how you can do this within your own work. So this is thinking about how you can get talking about health literacy. Maybe you want to use coverage to care, or at least some of the resources and principles and ideas that it discusses. So thinking about how you can implement that in the work that you're already doing to help consumers. So we do have a few resources for you, and we'll talk through some ideas. So first, to help us frame our mindset, I'll kind of recap how we use coverage to care resources. You want to start a conversation with a consumer. So you use the roadmap to help them figure that out. Where do they need to start? Is it step one with preventative services, or why this even matters in the first place? Or maybe they can dig into step 4 where they actually need to go and find a provider. So you may only be able to have time for a couple pieces of the roadmap at once, or maybe you need to spread it out over several interactions, or maybe you can dig in with a person to go through the whole thing all at once. But referring to the roadmap can help. You can give consumers a copy of it. You can order the roadmap at no cost. So you should be able to give them out to consumers if you'd like. It does have a lot of information in it. And it can be a lot for a person to take in. So that's why we find it best if you have the opportunity to walk through it with them to do so. But one of the best ways you can talk with a consumer is by personalizing it. So we know one way is to cover the areas that they need the most, but you know your community, you know maybe even the person that you're talking to. So how else can you help the message resonate with them? This could be the way the information is provided. Maybe you need to tweak it a little bit or add in some local resources. Maybe your own contact information would be something useful. So feel free to adapt the resources to fit what your community needs and what you need. And then another way is to use our partner toolkit. So the idea behind that is to basically try and make your lives a little bit easier. So you're always doing a lot if you're open enrollment or COVID and everything going on. Hopefully the partner toolkit can just help a little bit. And remember that anybody can use coverage to care resources. You can use them a little, you can use them a lot. All of our partnerships are considered informal. So if you use the toolkit, you use a resource, you attend a webinar, we consider you a partner, and we welcome you to use it as you see fit. So some people use coverage to care as a minor part of their education outreach. Others will have a lot heavier focus on health literacy, but do what works for you and your community. And hopefully these tools will help. So we'll go one more slide. So we want to make sure you have this information as well. All of our resources are available to order at no cost. So that's, now I will say, I should caveat that the Enrollment Toolkit is not currently printed. It has some information in it that we'll probably have to update in the next year, and we just finished it, so we're not able to print it in time for open enrollment. But the consumer resources, those are available in print. So they are available at no cost to your organization. So that means you can download them from the website. You can print them from the website or email a link. But you can also order them from the product order warehouse. So the link that's on the screen is just shared in the chat. But that would be the same place that you would order marketplace materials or the Medicare New Handbook and other resources. So all 8 languages of the roadmap and other resources are there as well. Just as a reminder, the roadmap, 5 ways, the preventative resources, and several other pieces are available in 8 languages, and those include English, Spanish, Arabic, Chinese, Haitian Creole, Korean, Russian, and Vietnamese. And then, of course, we have a tribal version of the roadmap. And lastly, Coverage to Care does have a listserv. So if you're looking for any updates, if we host any webinars like this, if we have any new translations or new resources or updates to resources, we will send out a listserv to let you know. So please feel free to sign up and you'll get the latest updates and information from us. Okay, so I believe we'll have some time left for some question and answer, and I'll turn it back to our moderator.
Thank you, Ashley. We will now take questions from the Q&A box. Please continue to send us your questions, and we will answer as many as time allows. So the first question we have is the Manage Your Healthcare Costs resource available in Spanish?
That one is actually not in Spanish yet, but that's a great ask, and that's something that we can look to do. We try and make the partner tools like that one available in English and Spanish, but we do need to do that for the Enrollment Toolkit and Manage Your Healthcare Costs are just English for now.
Great. Next, we have what languages are telehealth resources available in?
Okay, yeah, that's a great question. So that's one of our newer resources. So there's actually two telehealth resources. So one of them is provider facing. So that one is just in English since it's meant for doctors and nurses and physicians. That one is just English, but the one that is consumer facing is available in 8 languages. So that's again the English and Spanish, Arabic, Chinese, Haitian Creole, Korean, Russian, and Vietnamese. So the consumer one is available in the 8 languages. And if you're looking for telehealth information, actually our website has a lot of graphics as well, and then some other resources too. So we have a page on telehealth that lists the telehealth what to know for your family, which is the consumer-facing one that's available in 8 languages. And then telehealth for providers, so to help providers who maybe are setting up telehealth for the first time or looking for some tips on how to work with certain populations. There's a little bit of specifics about Medicare and Medicaid in there, but it also tells you how to have a successful visit with somebody who maybe doesn't speak English well or has an accessibility issue, some other ideas. And then we have lots of graphics too to help point you to those resources and some other links from HHS partners too. So that page actually has quite a bit on it.
Great. And then someone asked to reshare the partner toolkit link, so we will send that out in the chat now. And then someone else asked, some of the information is out of stock. Do you have any idea when they might be available?
I will take a look. It depends on which resource you're thinking. We have, we just did a recent print order, and those should be available very soon, if not now. I'll take a look at the stock list. If you have any particular resource that you're looking for, feel free to send me an email at the Coverage to Care, and I'll look up that one in particular. I wouldn't be able to do it right now, but send us the email and I can look it up. But in general, we try and keep the main resources stocked. We used to have step booklets, and we did stop printing those because they just weren't being used. So if that's what you're looking for, that one would be out of stock. But the main roadmaps and posters should be in stock. If not, then shortly.
Great. And someone asked, is it possible to have the enrollment toolkit translated in Somali as well? Cities such as Minneapolis and Columbus, Ohio have high Somali populations that could benefit from the translation.
Okay, that's interesting. Yeah, we definitely are looking at our current translations in general. We'd probably, to be honest, we'd probably start with the roadmap, some of the bigger consumer-facing resources, to see what other languages we should be offering those in. We would like to expand those, but we just need to figure out what those would be and how many we can do. For the enrollment toolkit, I think our next step is probably Spanish, but I love getting feedback about which languages you need. We do try and follow some of the call center data. It can be helpful to tell us what consumers are what languages they tend to be using. And we try to use Census Data Bureau to point us to what languages people are using most within the home. So that's usually how we try and find it, but I also do like to hear from people about what you're finding within your community. And then I can share that also with the teams that work regionally too, in case that they have any ideas or possibilities to help too. So do send us that information. That's great to know.
Great. And then someone asked for you to reshare what is available in Spanish.
Sure. So Spanish has, all of the main resources, and in fact, the actual Coverage to Care page is in Spanish itself as well. So if you go to the page up in the kind of not all the way up, but in the it's underneath the blue bar. It will say in Espanol, so you can actually click the page, and the page itself will be translated into Spanish. So that's one, and then of course the roadmap, as well as all of the preventative tools and the posters are all available in Spanish. And the partner toolkit, one of the links that was just shared in the chat, is available in English and Spanish as well. So that one's pretty important because that has the prepared language for you. So the partner toolkit lists out language that you can basically copy and paste, or maybe you want to copy and paste and add a little bit to it, or delete, however it works for what you need. But that is already prepared in English and in Spanish. So that's emails, listserv, social text, and then social graphics. And the graphics are also in Spanish. And the Spanish toolkit was just posted to the chat.
Thank you. And then in terms of languages, someone also asked if you'll be offering materials in Dari. It's a primary language for Afghani people.
Okay, that's great to hear. Yeah, send us and tell us where you're from if you don't mind putting that in the Q&A too, because then we can kind of help know where these requests come from geographically. But thank you, I appreciate that.
Someone also asked, can you create a social media graphic for the essential health benefits?
Yeah, I don't think I have a graphic on that, at least not one that we've done recently. But it is in it is in the enrollment toolkit as kind of a graphic that you could probably turn into one. But I'll see if maybe we can talk to the team about finding one that might work. I feel like I have seen one, so let us look into that.
Thank you. And then someone asked for your contact information. So Ashley, I will reshare the C2C email address. Is there any other way that folks can contact you?
Yep, the Coverage to Care one is probably best. My email is so long, it will get messed up. But I'm the only one that checks that box, actually. So it will come right to me. It's right in my inbox with my other email. So I will be able to get back to you quickly if you use that one. And it's easiest to remember. So feel free to reach out to us anytime. And if you have feedback on, like we'd already talked about sending us feedback on languages, but if there's topics or particular needs that you have in doing your work, whether it's just kind of in general or for your community in particular, please feel free to send it to us because we love getting that feedback. We'd also like to know if there are ideas or events that you've done in the past that have worked well. I love being able to share that information on this type of webinar. So sometimes we go a little bit more into depth about how you can partner in the community, or we hear from guest speakers about what they've been doing. Today, we wanted to be able to focus on those financial pieces ahead of open enrollment. But usually around springtime, we like to hold a webinar where we have guest speakers who can come and talk about what they're going to be doing to get people into care. So we'd love to hear any ideas on that as well.
Great. That's all the questions that we have received so far. So please continue to submit them and we will answer as many as we can.
And thank you to all who have participated today. We can always wrap up a little bit early if we're finished with any questions. But like I said, the coverage to care at cms.hhs.gov, you can reach me directly, and always happy to answer questions there or take any feedback or other ideas that you have as well. So that that resource box will go directly to me. So please feel free to send it anything, and I'll talk with the team about anything that we need to, and we'll get back with you.
Thank you. And then someone asked if the webinar recording will be available online to view later, and it will, and I will send out the link to that webpage now.
Great. Thank you, Julia. We do have a couple other webinars on there if anybody's looking for something from the past, including a few on chronic care management. So that's something that we hope to come back around to in coming years. Okay, well, thank you. It doesn't look like we're getting any more questions in, but I think we can wrap up for today, and I appreciate everyone taking the time out of their day to come and listen. And thank you for all that you do to help your community.